Okay, this is my clinical teaching plan for HIV and hepatitis C training for syringe exchange program staff by Wendy Blair Harrod, APRN FNPC. Needs assessment. 1 in 10 HIV diagnoses are people who inject drugs. HCV infections have increased 3.5-fold from 2010 to 2016, and the healthcare cost for HCV annually in the United States is $360 billion. Staff educational deficits are a need. Staff felt they were not educated well enough on HIV, HBV, and HCV to counsel syringe exchange programs. This session is necessary to enable the SEP harm reduction team members to correctly educate participants about HIV and hepatitis. The HIV and hepatitis testing rates for SEP participants is less than 12% currently. The learner description are the employees of the health department that work within the syringe exchange program. We have 1 Caucasian female secretary. We have 5 female Caucasian SEP support staff ranging from 30 to 50 years old with at least a high school diploma. An Asian female, 35 years old, a female Caucasian, 34 years old, another female Caucasian, 53 years old, and 1 female Latin American volunteer nursing student who is 36 years old. The goals and objectives of this teaching plan is at the conclusion of the session, learners will be able to identify HIV and hepatitis C transmission pathways and preventative measures, and also treatment options. At the conclusion of the session, learners will be able to review HIV and Hep C testing procedures. Learners will be able to discuss how HIV and Hep C affects the body, and learners will be able to communicate basic HIV and hepatitis C education to SEP participants. The methods of instructions are PowerPoint, lecture, role play, and group discussion. Methodology, literature review for PowerPoint presentations. There were several studies. I picked just one. As you can see, the study type was a cross-sectional and prospective study. The methods were simple random techniques and questionnaires, and the population was Nigerian medical students. The conclusion was that students preferred PowerPoint presentations over traditional chalkboard teaching methodology. Role play. I chose a study that was a questionnaire-based study using pharmacy students in India. The conclusion is that most students consider peer role play as an indispensable tool to acquire effective communication skills. The methodology literature review for lecture is the study type was a quasi-experimental study. The population was Iranian nursing students, and the conclusion was that integrating teaching methods were more successful than just lecture alone. And the methodology for group discussion, the study was an experimental study. They used Likert scale questionnaires, and they used first-year medical students as a population. The conclusion was that 70% of students agreed small group discussion is more effective than traditional teaching methods alone. The literature synopsis. 4 studies review examined 4 different teaching methods I chose to use in my project plan. They included lecture, role play, PowerPoint, and group discussion. All methods were validated as effective teaching methods. I chose 4 traditional methodologies to increase understanding and retention of the materials. The studies were similar in that they all used students that were of the medical field, and they all were adult learners in graduate programs of study. As we discussed before, there was 1 cross-sectional and prospective study, there was 1 qualitative study, there was 1 quasi-experimental study, and then 1 qualitative study. The learning theory integration was constructivism. The constructivism theory focuses on learning through past experiences, and that all learning is built upon personal experience. This theory values individualism. The learner extracts learning from individual experiences. Using several different teaching methods during one session allows learners to build on personal experiences and to link learning to a specific teaching method activity during the session. Audience appropriateness, role play, group discussion, PowerPoint, and lecture have all been successfully used in the past as teaching methods. Role play and group discussion exemplify social constructivism, and my audience have worked together as a team for years, so I understand these teaching methods will be beneficial for them. Lecture and PowerPoint presentations will continue to exemplify the constructivism by layering the framework from which my audience will base their learning. They will have the materials to refer back to and can use them to guide their discussions. The outline of the teaching content. My first objective is at the conclusion of the session, learners will be able to identify HIV and hepatitis transmission pathways and preventative measures and treatment options. The method of instruction is lecture and PowerPoint, and the time allotment was 30 minutes. Second objective, at the conclusion of the session, learners will be able to review HIV and hepatitis testing recommendations. The method of instruction was lecture and PowerPoint. The allotment time was 15 minutes. The third objective was at the conclusion of the session, learners will be able to discuss how HIV and hepatitis affects the body. The content was reviewing HIV and the hepatitis C effects on the body. The method of instruction was lecture and PowerPoint, and the time allotment was also 15 minutes. The final objective is the group discussion. The final objective is at the conclusion of the session, learners will be able to communicate basic HIV and hepatitis C education to SEP participants. It will be a Q&A session and a role play session. The method of instruction is group discussion and role play as well. The time allotment was 30 minutes. The evaluation will be used on a survey that will be given to the SEP staff after the instructional time is finished. It's going to assess whether their needs were met or not met regarding the objectives. Another evaluation is an evaluation of the PowerPoint lecture, of how the material influenced their knowledge on the objectives, and this was on a Likert scale. Additional resources you'll find at the CDC. Here are my references. And thank you very much.